Good day, everyone, and welcome to a very important, very serious topic about teen and trauma. We are very lucky to have two specialists who are going to talk about different ways and approaches and identifications of teen trauma. Center of the Virgin Islands, we do advocacy. We do advocacy in two forms. We do lay advocacy, which doesn't require legal advocacy or attorneys, and we also do, of course, legal advocacy, and we do have attorneys on staff. We provide information referrals. We provide short-term assistance and long-term assistance, depending on what you need. Topics, we really cover everything, almost every disability, almost every age, from children to childhood, all the way up into seniors. If you are dealing with discrimination, or if you're looking to help navigate your rights about different areas in your life, Disability Rights can help you. And if we need to help you longer, we do have the capacity to do a little bit more assistance one-on-one. Okay, so with that, I want to go ahead and pass it over. We're going to start with Mr. McMillan. He will start the presentation for us, and he is a licensed professional counselor here in the Virgin Islands. And take it away. Thank you, Mr. McMillan.
Thanks for having me. Good afternoon, everybody. My name is Tarik McMillan. I am a licensed professional counselor in the Virgin Islands. I'm also licensed to practice in the state of Florida and New Mexico. I am one of the co-owners of Greater Changes. We operate in the Virgin Islands, New Mexico, Florida, along with my wife, Tamara Mohammed, who is also our clinical director. We do individual counseling, marriage and family counseling, group counseling, as well as different workshops and presentations. And we also, a little more recently, the last 2 years or so, been doing behavioral health consultation with different agencies and companies. So really do a lot. And it's been an incredible journey so far. I'll get into talking more about trauma and navigating it, specifically in teens. But I usually, just to I guess build some more rapport with the audience and whoever else is listening, talk a little bit about how I got into the field. So I've known I wanted to be a counselor since I guess maybe 5th or 6th grade or so. I moved to the state of Florida, and at the time, I guess it was a weird time where there was a lot of these weird jokes about being from the Virgin Islands and having this idea of us living in huts and swimming to school and really silly stuff. And just it was really weird, and there was a lot of bullying that came as a result of it. And I eventually went to a counselor to address some of the issues that had been happening in school. And initially, things were going really well. And I remember feeling really comfortable with the therapist, and I started using my accent. And that was one of the triggers that led to the bullying outside of it. And when I did, he laughed. There was it wasn't this outlandish laughter, but it was a chuckle. It was what is that? And I just remember shutting down completely after that. And for a while, there wasn't any desire for me to go to counseling or talk about anything. But I do remember thinking to myself that I know that I could do this job and I could be a therapist. I know I wouldn't make anybody feel that way. I think that was the foundation of where I'm at right now in terms of being a counselor. So fast forward a few years, and I've worked in a lot of different fields. I actually worked at the village a few years ago, but I started out in a residential treatment facility working with children ages 6 to 17 who all had some kind of traumatic experience. So whether it was sexual violence or physical abuse or neglect. And I think that was some of my first introductions into seeing trauma play out in outside the context of what I was learning in grad school. So yeah, so that's a little bit of me and where I started. And then I moved back home in 2017. And that was the year of the hurricanes. And then seeing like the devastation and like having this like push to like do something was like a huge motivation for me to get into the field here and eventually start greater changes with my wife Tamara. So that's me. There's a lot more to it, but that's me in like in a nutshell there. The other thing that I really like to do whenever having a conversation about trauma, specifically in the Virgin Islands or the Caribbean region, is to talk about stigma. Um, when we talk about stigma, there's like I think there's this assumption that we came up with these negative beliefs about stigma on our own. And the stigma that we have related to mental health, like, it's not inherent to Caribbean culture. These are things that we were taught through colonialism that led to this belief. Um, so when you look at pre-colonial societies in the Caribbean, they already had um, systems of mental health that wasn't like a us and them type of structure where like we look at people with mental illness as like a problem and something to like push to the side. It was how do we how do we provide for the people who obviously need our help? But through colonialism, you have like the introduction to European mental asylums, which is notoriously they're known for being violent and like just having torture be associated with it. And then those things kind of like spread through the Caribbean as colonialism spreads through the Caribbean. And then you reach to a point in like the 1900s, like I guess 1930s to the 1960s and 70s, where Caribbean countries are looking at colonialism as like a thing that we need to expel. And they also view mental health asylums as something that we need to expel. Um, so though we do away with the asylums in the Caribbean, unfortunately, we don't do away with the stigma associated with mental health. Those are things that like stay and linger. And I mean, luckily, we're doing a lot of work to be able to address these things, but we still have a very long way to go. Um, it's kind of amazing to see like where we are today in like terms of having conversations about mental health. Growing up, for sure, we didn't have those type of conversations at all. It was a lot more of like that's a crazy person or that person off. Like you still hear it in certain pockets, but a lot more we have much more emotionally intelligent conversations about mental health. Um, so I won't talk too much about stigma because kind of did already. But when we look at probably one of the most devastating forms of stigma, we look at label avoidance. And it's like the person choosing not even to seek mental health treatment as a way to not be assigned like this label. So when we look at statistics of mental health in the Virgin Islands, just for example, between 2005 and now, there has been a 350% increase in our suicide rates. And so that's a huge number. I think all of us can attest to being either knowing someone or having someone within a close network of us um, be affected by suicide. So it's a huge issue that we need to continue these conversations and find the means to address the issue. Now, when we start looking um, at trauma, I think it's such a nuanced conversation. Initially, when we started this, and I was told that we have 15 minutes to speak. I was like, oh, what am I going to say in 15 minutes? Like, I don't know if I could fill up 15 minutes of information, but I have my timer going over here and I see I'm already at like 8 minutes. So obviously there's so much to talk about. But when we look at trauma, it's usually defined as like the thing that happened, but really it's the response to that thing. And it's broken down into acute, chronic, complex, and intergenerational trauma. Acute being the immediate response to a singular event, chronic being response to prolonged or repeated exposure to traumatic events, and then complex being exposure to multiple traumatic events over a longer period of time. And intergenerational, which is it's a trauma response that's been passed down through generations. And I find intergenerational trauma to be incredibly interesting, just in the way how you don't have to necessarily experience a traumatic event to have this traumatic response be passed down. When you look at people who have been their grandparents have lived in places where there's a lot of like bombings or war, you see that the generations that come after have usually have a heightened startle response because in order for that person to survive, the person who been through the war and the bombings, they had to be able to like tense and brace for all this impact. And even though this future, the great grandchild of this person may not have experienced this, you still see this traumatic response being shown by this by that person. So if you put that into the context of Caribbean culture and you look at a great great grandparent who may have experienced slavery or may have experienced some form of negative treatment associated with colonialism or white supremacy, there's a direct correlation with those traumatic responses as well as us living in systems that don't necessarily always have the support to take care of us. Um, so it's a really fascinating topic. And we could probably sit here for forever and talk about it. Some of those traumatic responses include things like fight, flight, or freeze, which I think we're like at this point we're a little more familiar. Fight being like attacking the perceived threat, flight running away from it, and then freeze becoming immobilized when there is that threat. More recently, and I think within the last decade or so, there's been conversations about the fawn response, which looks at how a person appeases a perpetrator and trying to minimize harm being done to them. I think I often see this um, when I work with women who've been in abusive relationships, and they have their friends or their loved ones around them kind of like questioning like why do you keep trying to go back and like appease the person, and they themselves questioning it without really realizing that this is a trauma response more than it is like this desire to be back into this relationship. So like when we don't have the language to define what's actually going on, you have we have a tendency to look at these behaviors as simply just like choice, and this person is doing this because they just want to, and that's one of the damaging thing that also ties back into stigma and the way we look at these things. The last thing I'll say real quick is I mentioned suicide as something that we have to look at, specifically, especially if we're talking about children. There was some data that came out, I think it was about 2017, that showed that 22% of middle school students in 2017 seriously considered suicide. And then 8% of middle school students had attempted suicide. And then 17% of high school students considered suicide, and 10% had an attempted suicide. So if we think about this, this is 2017. Those high school students are now adults, and unless they have like come into contact with um, an incredibly healthy support system, access to mental health, to mental health care, you have these people who've had who've attempted suicide, who've seriously considered suicide, now having to deal with the transition into adulthood and everything that comes with it. So whether it's bills and children, unexpected expenses, like all these things compound on this this person who was a child who had these experiences. And it's just something when you consider, like, it really is terrifying, like where we'll be in the next 5 years, where we'll be next year. Um, One of the biggest things that I think we could do as a community, and we could do as individuals, is to learn as much as we can about mental health, about suicide and addressing suicide, to be able to normalize these conversations. Statistically, when a person or a community has a higher mental health literacy, meaning that they can identify warning signs of depression or anxiety, or warning signs of PTSD, it makes them more likely to refer someone to get help, as well as to be able to be a support to them, to be able to use emotionally intelligent language that's informed not just by stigma and opinion, but by actual literature. So I think these conversations are incredibly important. DRCVI, I think this is huge. I think I don't remember how much people are on the call. I think I see 31 here, and wherever else this is being shown. But if every person who is on this call can take this information and give it to two other people, like, and then that keeps on going, then we have something that's really transformative. The last thing I'll say is that we often think, and I just had this conversation with my younger brother this morning, about how we often view doing something radical as being as necessarily being like a huge gesture, when, like, the thing doesn't have to be a huge gesture for it to be radical. It just has to turn the dial in a really meaningful and impactful way, like these conversations are. So, and I didn't get to go into like what trauma looks like and all the different symptoms, but I really do hope that this last like 15 minutes I have been talking have been informative and like really stirs up some more conversation and questions in the later part of this segment. Um, Thank you very much.
Thank you. Thank you, Mr. McMillan. And one of the things that we is just continue to be startled with, I think, is the suicide rate. So that was very important in terms of those stats that you gave and how closely it is very much related to the trauma that teens are dealing with, especially here in the Virgin Islands. Thank you. Thank you for that. All right, next we're going to have Ms. Brookes on, and Mr. McMillan, of course, will be staying for Q&A. Ms. Brookes, wonderful. Ms. Brookes is the prevention coordinator at WestCare, or AKA known The Village. I'm going to hand it over to you, Ms. Brookes. Thank you so much.
All right, good afternoon, everyone. My name is Brandy Brookes. I am the prevention coordinator, as Shami said, at the Village Virgin Islands Partners in Recovery, which is under the West Care Foundation. For those of you all who do not know, the Village is the only residential treatment facility for people who are dealing with addiction in the territory. So if you're in St. Thomas, St. John, Water Island, or here on St. Croix, and you need 24/7 care, you'll go to our facility in Sand Hill for 24/7 support and care as you deal with all the challenges that come with addiction or substance use disorder. I am speaking to you from our Richmond location, which is our prevention office. It is a lot newer than our treatment facility, which had been around for, I think, about 3 decades or so. Our prevention office just got started up within, I want to say, the last 5 to 10 years. And it is focused on youth between the ages of 13 to 24. So this is a program that is continuously expanding, and we are continually building on our prevention program so we could continue to service the community, not only when it comes to treatment, but of course, when it comes to prevention. So my presentation is focused on tackling trauma in order to hopefully prevent substance use disorder in youth. So here at the prevention office, we have a number of programs. You know what, before I get into that, I do like how Tarik kind of spoke about how he got into the field. So I'll do the same. I actually majored in public relations at Howard University. So mental health wasn't my focus, but that is initially actually what I wanted to study. And, sometimes life just redirects you to where you need to be. And the reason why it is important to talk about trauma when we're talking about substance use disorder is, we all know that when it comes to addiction, it's layered. Most people don't just get up and decide that they want to use a substance. And when we see people who are dealing with substance use disorder, sometimes we ask why. And a lot of times it is, we're going to speak about it more, to cope. And there are a number of things that people need to cope with, just being alive, we face a lot of challenges. And and difficulties, and it can become difficult for us to manage. So, substance use is something that we see here a lot. And with a focus on youth, when we go to the schools, we see them utilizing substances from tobacco to marijuana to alcohol. And it is, again, to deal with what they were dealing with in their home or at school, etc. Me personally, when it comes to mental health, I try to be as open as possible because, as Tarik touched on, one of the big reasons why people don't seek care or help when it comes to mental health or substance use is the stigma and not wanting to be labeled. And I'll say for myself, when I face my own mental health crisis, because I feel like most of us on this call, if not all of us, have dealt with some type of mental health challenge, if not crisis, at this point. But when I dealt with mine, I had some difficulty actually seeking care because I didn't want to be labeled as quote unquote crazy. I didn't want people to see me differently. So I had my own internal fear. Even with the information that I know about seeking care, I was still hesitant. So keep in mind, there are some people who don't have access to resources, don't have access to information, the stigma that they're facing or the difficulty that they have seeking care when it comes to stigma may be a lot greater. So we'll get into the presentation. I want to start by defining trauma, which everyone on this call who has spoken so far has done a great job of doing, but I want to expand on it a little bit more so that we could focus on substance use disorder. When we talk about trauma, we say that and this is a definition that I pulled from the American Psychological Association. They have trauma defined as an emotional response to a terrible event like an accident, crime, natural disaster, physical or emotional abuse, neglect, experiencing or witnessing violence, death of a loved one, war, and more. And I have this definition here, but it's definitely not my favorite definition of trauma because it says here that is a terrible event. And the things that are traumatizing to me and the things that are traumatizing to you and whoever else can be completely different, right? So while they have some very, very big traumatizing events, war, abuse, neglect, etc., there are day-to-day incidents of trauma that you might not consider to be trauma, especially when we're talking about youth. Something that is traumatizing can be distressing, disturbing, and just elicits, a negative emotional or psychological response. So something like, I'm a great student and I suddenly fail a class. That could be traumatizing to me in my youth. A change of family dynamics. So maybe no one died, but there's a divorce, or I see my parents fighting all of a sudden, or a parent has to go away from work. So trauma in youth, especially, I don't want to say it looks different than adults, but a lot of times people minimize the trauma that youth might be facing. And they say that, they don't have any real issues when in reality, they're navigating the world for the first time. We focus on people between the ages of 13 to 24. And a lot of the things that they're experiencing for the first time without the tools necessary to do so. So how do a lot of people manage? There are many healthy ways, and I'm sure people on this call know some of the healthy ways that we're going to talk about a little bit later. But a lot of times when people are dealing with mental health challenges or trauma or any negative mental health challenges, that they're dealing with in life, they immediately turn to substance use. And when substances come into play, a lot of people ask, how did you get there? And it's very easy to kind of think of how people end up using substances because, one, it is extremely accessible. I can go to any store on any corner, any grocery store, any gas station, and pick up a bottle of alcohol, some beer. I could get a pack of cigarettes. If you know where to find marijuana, you could find weed. You could find someone to buy it for you, and it is a quick fix. It is something that will provide immediate relief to whatever it is that I'm dealing with. So while people talk about prevention, one of the worst ways to think about prevention is just saying no. And we see generations before where most prevention programs was just saying no to drugs, just saying no to alcohol. But that's a very, 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 very small piece of the puzzle when it comes to talking about prevention, because again, it is so accessible. And when it comes to dealing with mental health challenges with the stigma of seeking additional mental health support or care, I might just prefer just to get something that I know will be easy and I'll be the only person facing this by myself. But it is important to focus on the fact that even though it is providing relief, it is temporary and it's fleeting. And at the end of the day, when we see clients come in to deal with their substance use challenges, it is layered, and they have to now unpack the initial trauma or unpack the initial incident of trauma and whatever came along with it, as well as now their substance use disorder as well. So while it is a temporary fix, it is not long lasting, and you continue to create, you continue to re-traumatize yourself and create further challenges for you to deal with as you go along. So when it comes to prevention, I just spoke about what it is not. And I want to add that in addition to it not being just say no, we don't want to focus on punishment for substance use, okay? Of course, we know that it is not the best tool to cope with whatever challenges you're facing, but we also know that if someone, especially between the ages of 13 to 24, or, you know, the people who we see in our treatment facility in Sand Hill who are, you know, older, when they're using substances is because they are having a difficult time coping. And it is sort of, you know, call for help when you see someone, especially between the ages of 13 to 24, using substances. It is not just that they got up one day and was like, I mean, maybe some people do use substances for fun, but at the point where we're seeing somebody using a substance, instead of immediately turning to punishment as the response, we need to find out what exactly is going on that is leading them to use a substance. So punishment and just saying no aren't the most effective ways to prevention, especially when it comes to actually creating long-lasting change. One of the expressions that I like the most when we're talking about something like this is the fact that what we run from tends to chase us. So if we're talking about just saying no, we have to focus on what we are saying yes to. So instead of just saying no to drugs, what can I do in place of the drugs, right? So when we go to do our presentations in the schools, what our main focus is creating empowered youth, right? So our curriculum is focused on self-esteem building, goal setting, dealing with anxiety, dealing with anger, dealing with depression, things that lead them to use substances. How can you have fun sober? How can you connect with your peers? How can you deal with peer pressure? So it is a curriculum that's focused on becoming an empowered youth as opposed to just saying no to drugs. Because why am I saying no? Especially here when I'm on St. Croix, and I don't want to say we have a culture around substance use, but we see a lot of substance use, okay? And we see a lot of substances being used, you know, whether it is to celebrate, whether it's to cope, if it's just in the house to relax. A lot of times when we see people between the ages of 13 to 24, it's because their parents might be doing it and they're exposed to it in their environment. And it's very easy, again, for them to access. So to talk more about how we make prevention work or how we try to make prevention work, and this is not foolproof, okay? This is not 100% effective. We're not gonna always see people who come in, cut out their substances completely. Our goal is for them to cut down, cut back, make healthy choices, and hopefully cut it out completely. So I did some research on what are the most effective ways to work with prevention, to do prevention, and to focus on trauma. So one of the ways is school-based programs. So we have a life skills training program, which I mentioned to you all before, where we go 10 to 15 sessions and we talk with the students and we do the curriculum and we tailor it so that it's focused more on the youth here, because there are some things that, you know, are used to address students on a national level that culturally don't translate the best. So we try our best to make it culturally sensitive. We have family programs, family-based programs as one of the prevention tools. We spoke about Tarik, and I think Shami touched on generational trauma and how that could lead into continuous trauma. Now, I'm traumatized because my parent dealt with trauma, my grandparent dealt with trauma, and so that is one of the reasons why we want to focus on family-based programs. Now, I'm not old enough to see any of the clients, any of the children of my clients, but I was speaking with my colleague, and she's now seeing a lot of the children of the clients that she served maybe a generation ago. So it's important that we focus not just on what's happening in the schools or, you know, talking through therapy, et cetera, when we see now that it's a crisis. We want to make sure that the home, the household is equipped with the tools necessary to make healthy choices and communicate in a way where we're not continuously traumatizing each other. So we have our Strengthening Families program for people between the ages of 7 to 17, which focuses on addressing the issues that we see commonly in the household. Community-based programs, so reaching out to people where they are. So one of the main ways that we actually are able to service the people on this island is actually going to where they are. So we do a lot of door-to-door outreach, and we're going to be collaborating with the local housing authority to continue to service people where they are, because at the end of the day, a lot of times when we're talking about mental health and we're talking about receiving therapy, or we're talking about some substance use prevention, you know, they're interested. And then when we say, okay, come into the office, something about coming into the office, I don't know if it's being seen coming into the office or just that extra step of transportation, it could be a barrier to care. So community-based programs is one way to address trauma, especially when it's focused on prevention. Peer-led programs. So I'm younger, but I am not necessarily in the age group of the people who we serve. So when we're talking about prevention programs, we're talking about youth, people 13 to 24, we want to make sure that they're informed so that they could continue the conversation in a way that is more relatable for people in that age group, that is more, I don't want to say cool, but it connects to them in a way that we won't be able to connect to them. So, you know, we don't have too much pride to say that there are some things that we might be missing when it comes to being able to connect to that age group. So we try to educate people who we feel would be, you know, leaders in their community so that they will be able to continue the conversation long after we leave the classroom. Media campaigns is another way to focus on reducing the stigma, and that is something that we do. We run radio ads, billboard ads, we put up flyers, and just make sure that we're in the face of the community as much as we can, so that even if they don't call us, even if they don't come to our office, when it is time to connect with the people who we need to connect with, it's important that we at least have some type of marker that they could refer back to say, like, you know, I saw the village, I know about the village. So just increasing familiarity overall. And then of course, doing discussions like this, having discussions like this, where our message, it doesn't just stay in the office. We could connect with people who could connect with the youth, who could connect with the families, etc., who need this information. And of course, say it in a way that will be relatable to them as well. Another thing that we do is brief intervention. So one thing, after we do our prevention program, we don't want to just leave them where they're at. Because again, when I said we're dealing with prevention, a lot of these youth already use substances. So after we finish our prevention program and we equip them with the tools to cope, hopefully, we do a brief intervention so that we could see what are the next steps. We don't want to leave them hanging. So we have our Adolescents in Recovery and Community Connections program, where if we identify someone who has used a substance, we'll figure out whether they need additional care. And through that program, they'll be able to have therapy, case management, family support, etc. And that is a treatment program for people between the ages of 12 to 25. And again, I just want to touch back on healthy coping skills when it comes to dealing with trauma, because if you start using substances, it's kind of difficult to now figure out what healthy coping skills could work for you. I was talking with a group of students who are identified as using marijuana, and I asked them, like, have you ever tried, maybe before smoking, what are some things that you could do to reduce your anxiety, reduce your stress, etc. And they couldn't really come up with anything. And there are many things that you could do to cope and to elevate your mood, etc. And you have to have an extensive list, especially when you're talking to people who are dealing with trauma, because some things might not connect with them. I might say meditation and they're completely disgusted with even the thought of trying to calm their thoughts down. Journaling might not work for some people, you know, but they might like writing music, creating music, playing a sport, exercising, etc. So anything that is focused on healthy coping is something that we want to share with them, but we want to make sure that we have a long list of things so that, you know, meditation and therapy might not be what they want to do right now, but what can they do right now in the meantime to uplift them until they're ready to try something like therapy, etc. And most importantly, when we're talking about coping, I like to let people know that it is a muscle. It is not necessarily something that's going to come overnight. Okay, so we're talking about journaling, meditation, etc. These are not quick fixes in the same way that a substance might be, but it will create more long-term satisfaction, and you will have less issues to deal with in the long run when we use healthy coping skills to unpack our trauma. And of course, you know, when it comes to seeking mental health care, just know it doesn't mean that you are weak. It doesn't mean that, you know, anything is wrong with you. But in the same way as lifting weights, I'm talking about, you know, coping skills being something like exercising a muscle. When you're lifting weights, sometimes you might need somebody to support you to carry the weight and, you know, feel confident that you can do it. And it's not necessarily that they're lifting the weight for you. They're just there to support you and show you that you can do it. And it's the same thing with therapy and counseling. It's not necessarily that they're carrying the weight of your trauma or carrying the weight of your mental health challenge, but they're showing you that you are capable of overcoming something and you're capable of dealing with your trauma. And that is what we try to do here, empower people. And our motto at West Care is uplifting the human spirit. It's not getting you off the substance. That's not our motto. Our motto is uplifting the human spirit so that that person can be empowered enough to tackle their trauma, deal with their trauma with support, of course, and hopefully reduce substance use and create a healthier community overall. So that is the end of my presentation. I do want to thank you guys for inviting me to speak, because this is something, of course, as Tarik said, we could speak forever about this. This is just really scratching the surface. But I hope, of course, with the questions and the conversation that we're having, that we have enough insight so that we could continue our week and this month and this year with this conversation in our communities, in our family, in our schools, etc. So we could create healthier communities and reduce you know, the likelihood of utilizing substance to deal with trauma.
Absolutely. And thank you, Ms. Brookes. That was a lot of information, and so much so that people are just like, they want even more. So the first thing is I want to address right away is if you guys could put your contact information in. And the question was, do you service the other islands? So maybe that's the first question you guys can answer. Ms. Brookes, if you want to go first.
Okay, so our treatment facility in Sand Hill, it is residential, so anyone from any of the Virgin Islands can come for the 24/7 care. And this is funded through DHS, I believe, and other grants. So, you know, as far as cost, that's not something you have to stress about, but we do provide residential care at Sand Hill. When it comes to our Adolescents in Recovery and Community Connections program, which is a small prevention, but mainly treatment for people 12 to 25, it is not residential, but you can come to our office both here on St. Croix and in St. Thomas at the Niski Center for treatment between the ages of 12 to 24.
Wonderful. Thank you for that. And Mr. McMillan?
Yeah. So we have an office in Frederickston on St. Croix, on Hospital Street behind St. Paul's Church. If you're familiar with Frederickston, it's where our town Frederickston's main office is. We also we have another provider on St. Thomas, but we also do telehealth. So if you have a computer, a laptop, a tablet, a phone, you're able to meet with your provider anywhere. I've had people go to the beach and had their sessions there because they didn't have any privacy at home. So yes, we do service St. Croix, St. Thomas, and St. John.
Wonderful, wonderful. And Kishma, if you could maybe help do the questions, I can't see them as well in the chat, and we can get that going to start the Q&A.
Okay, good afternoon all. Question, are there any group therapy available for teens on St. Croix?
So as of right now, for us, we are building out a few different groups that we hope to launch this summer.
Okay, so great. I'm glad you answered that first because we, as of right now, we don't do group therapy. It is one-on-one sessions. We provide though peer support for prevention. So, you know, again, when we were talking about having the peer-to-peer connection so that they could make prevention more appealing to each other. One of the things that we're doing is having a youth task force so that they could come together and create the messaging and create different events, etc., so that they can connect with people in their age group. So I think, Tarik, you said that you guys are going to be doing the therapy groups. So that would be great. As of right now, the village doesn't do group therapy for teens.
Okay, the next question. Are there any resources, sites that can be shared to the students and families the presenters would recommend?
So for me, I would, if you're looking for mental health information, and specifically like trauma related, I think cdc.gov is a great place to find information on mental health. Um, I think we also like we play down, or maybe sometimes we just don't use Google as effectively as like it is, and using like Google Scholar to be able to find like more evidence-based articles on these topics, and as well as TikTok. Like, I mean, some of it, you know, you have to like really be mindful and, you know, consult with another mental professional, but going on TikTok and finding information on trauma, on mental health, I think that's been incredible. That's like been transformative over the last few years. However, well, taking that with a grain of salt, like some information, like there is no vetting process for TikTok, right? So making sure that you take the information and also like put it against like other information that's out there and consulting with a mental health professional. Yeah, I think that's, yeah.
Yeah, I agree. So especially when it comes to you, Tarik, like TikTok is a very great tool when it comes to mental health because it makes the information digestible, you know, and, you know, tidbits that they could continue to research. So our prevention program is funded through SAMHSA, which is the federal organization Substance Abuse Mental Health Service Administration. So I'll type it in here, but there's a lot of articles on there, a lot of different documents that you could read that focuses on substance use disorder, focuses on trauma, and focuses on mental health as well. So I'll type it in the chat.
Good, and also for the presenters, I did put your email contact information, but I believe they're trying to get telephone numbers as well. So if you can put that in the chat.
Yes.
And there's also a follow-up question for Mr. McMillan. Will MEP patients be accepted into the upcoming groups for adolescents?
Yes, and we do currently accept MEP for individual therapy as well.
Okay, see your next question, comment. Love the models of care. Can someone give your prevention services available? As I do believe prevention can be a source of treatment like social skills group.
Okay, so yeah, I'll just speak about the prevention services that we offer. One is Project Horizon, which through that we offer BOTVIN life skills training, and it is curriculum based, and it is 10 sessions for high school students, 15 sessions for junior high. And that one we go into the schools and we meet with them at least once a week for an hour. We just continue to have conversations about coping skills, how to become a well-rounded youth, etc. We also have our Strengthening Families program for people with children 7 to 17. So it doesn't have to be parents, it could be grandparents, guardians, etc. As well as our teen intervention program, which is a brief intervention program 3 sessions where we discuss how they can reduce their use and hopefully overall cut out their substance use, whatever substance they're using. And we also have our art program where they go in and they do group sessions. They do a curriculum called Seeking Safety, which is heavily focused on healthy coping skills, etc. And then, of course, the treatment for youth as well.
For board presenters, what is the referral process for services?
So, so for us, there's a few different ways. You can go directly to the website, www.greaterchangesllc.com, and request appointments directly from the website. There's no need to print anything. Like, all the information can be done on a phone, on a tablet, on a computer. You can also call the number 833-409-3474. We also have a community referral form that we typically use with various agencies, so DHS or behavioral health. Yeah.
Okay, so for us, we either go to the schools, we make some type of connection with the admin so that they can know that we're here and an available resource. So they call us when they identify students who might need treatment, but also we just ask them whether or not we could come into the schools and provide our prevention program. So it's a collaboration heavy program. We also get referrals from DHS for people who they think would be a great fit. As well as we do door-to-door outreach, collaborate with Housing Authority. And of course, like, people could call us and enroll themselves in our programs as well. And I also want to focus on the fact that when it comes to the family program, when we're doing recruitment or we're doing outreach, a lot of people always focus on the families that they believe would, quote unquote, need the program. So they always think about families that are having difficulties, etc. But we always like to emphasize that anyone can do our Strengthening Families program. Anyone can learn new communication tools. And the biggest part about our Strengthening Families program, it is a group program. So we come together and have conversations about things that we do in our household, so that we could share and have a conversation about how we could, use the tools that you use, or maybe like shape our focus into something, into communicating in a way that's productive. So we don't want to focus on the fact that people think that it's, families who are in need, or families who are highly at risk, etc. It's for anyone who wants to do the program.
Next question, what programs are available for our teens in the public schools?
I don't know what programs I believe they have an intervention hour at all the public schools, at which point they collaborate with different organizations to come in to do different group sessions and host conversations like the ones that we're having now. But as far as the programs that they have embedded into the curriculum, I'm not sure what that looks like. But that is how we collaborate. We go during the intervention period, but I don't know, Tarrik, if you have an answer for what programs they have currently.
Outside of, I think, behavioral health, going to a few schools, the division of behavioral health going to a few schools, and like having some conversations. I'm not sure what other programming exists. Maternal child health, that division under Department of Health also does a lot of work in schools. They do mental health screenings, they do dental, and I don't remember what medical screenings they also do. And they also do various presentations and workshops to students.
I'm really glad you brought that up. That's actually one of the ones that Ms. Williams worked with, is with MCH. And they actually are going into the middle schools as well, the older children, to do screening, including mental health. So thank you for bringing up MCH.
We have a common question. It says, my teen lost her father to suicide. When I brought her to get help with effects of trauma from this loss. They looked at her symptoms and wanted to test her for ADHD. Clearly not trauma-informed. There is an incredible deficit of quality mental health providers on St. Croix. Does Greater Changes offer counseling, etc.? This island is way behind in mental health care. Thank you for having this important conversation.
So the first answer is yes, we do offer mental health counseling on St. Croix, both in person and virtual. Also, I think there is an incredible overlap between trauma symptoms and ADHD. And sometimes there is so much overlap that sometimes there's misdiagnosis on both ends. I think, but I will also say that we are in a position where we do not have enough mental health providers in the territory. We are listed as a health provider shortage area, meaning that we don't have the amount of providers for the population that we have. There is an incredible push to be able to create a direct pipeline for UVI students to get the education necessary as well as the training to be able to be licensed in the Virgin Islands. I would love to have more of that conversation because there's so much to be discussed there. But that's something that's being pushed. Hopefully we see that bill be passed really soon. But again, yes, we are like way behind when it comes to mental health care.
Ms. Brooks, did you have anything to add to that by chance?
No, I think Tarrik covered
Okay.
it.
All right, we've got just a couple of more minutes. We want to be mindful of people's time. Kishma, I think we can take maybe 2 more questions.
Sure. What about internet addictions? Are they considered?
Not directly through our services, but the goal is to address the issues that lead to addiction overall. So we would hope that when we're talking about how to create a healthy life, that they understand that, you know, anything that gets in the way of that, whether it's an internet addiction or addiction of any other, of any kind, would affect their ability to live a healthy life. So one of the biggest things that we focus on when we're talking about prevention is goal setting. So that I think is one of the first things that we talk, well, one, self-esteem, and then 2, goal setting. So when it comes to the future that you want to live, what steps that you can you take to achieve those things, and what gets in the way of it? So while we don't focus directly on internet addiction, we focus on the life that they want to create and what that looks like, and then everything else that falls outside of it, how can we try to avoid those things so they don't become an issue? So I really like that question, and I think that there should probably be more programs that specifically addresses that, because we're seeing that more and more and more and more, and it's affecting people to the point where, you know, we see a lot of youth who have trouble communicating, trouble connecting with their peers and living healthy lives because they're living partially, if not primarily, online. So that is a great question. Thank you for asking.
Seems like all the questions and comments for now, Shami.
Okay, wonderful. So as we wrap up today, it is very obvious that people are not only looking for more information, but they're seeing it as a system-wide issue throughout the Virgin Islands. I see a lot of comments about, you know, an ongoing situation and what more can we do and what's the next step. And so I think as a community, it might be really good for us to do some internal thinking about how we can be systematic in helping our children, especially due to the fact there is a shortage here with mental health providers. And the example the person just gave about ADHD, and someone commented, everything is ADHD and everything is not ADHD. Some things are very, very much so dealing with trauma and dealing with depression and anxiety, all that comes with that. So on that note, again, just want to really thank Ms. Brooks and Mr. McMillan so much. I can see in the comments the appreciation of the information, the sincerity, your own personal stories, and helping to get where you are to help others here in the VI and otherwise. I know, Mr. McMillan, you also work in some other states, which is great, in helping the youth. So with that, we will be having another mental health related training in a couple of months. Be looking for that, I believe, in July. Want to thank obviously the presenters as well as the audience for taking your time. And thanks to DRCVI staff as well for helping and participating and coordinating today. With that, we thank you. Thank you. Have a very good day and let's look out for each other, okay? Take care, everyone. Bye-bye.